our botanical avatar. What would be the most amazing plant for this condition? What would it have? Now that you understand all the mechanisms, and thank you for entertaining my minutia part there, but I want you to understand then how these plants are working. So it's infection induced. We would want it to have broad spectrum antimicrobial activity, immune modulating activity, neutralizing neuroinflammation, be a brain antioxidant. So some of that cleanup and getting that maturation from M1 to M2 in the microglia, reducing dopamine, reducing glutamate, boosting GABA, boosting serotonin, protecting the kidneys and healing the gut. Wouldn't it be wonderful if we had a plant that did all of those things? We do. And the tie that binds are plants that are rich in triterpenoid saponins. The tie here that binds is that they're lipophilic. So we see that those saponins can move through the nervous system. They can move intracellularly, and they affect the mitochondria. They immune modulate. They're steroidal in nature, so they handle that inflammation. They restore neurotransmitter imbalances. They're antioxidant, and they restore program pruning in the brain. Wow. So let's meet some of them. Oh, first of all, we have to talk about the botanical potential batatars. I guess I couldn't think of another word that was like counter to avatar. If anyone knows, please email me. These would be things that worsen the neurotransmitter imbalance, i.e. things that boost dopamine. So if it's good for Parkinson's, if you kind of know this plant is good for Parkinson's, make sure you're researching it first to understand why and how, and be real cautious with infection-induced autoimmune encephalopathies with that plant, because what you could be seeing is an increase in expression and an upregulation of dopamine and dopa receptors. While that seems like that would be good to upregulate dopamine receptors to preserve them, we actually have some botanical avatars that do help preserve the receptors, but are not upregulating them by flooding the system with more dopamine. So really understand your mechanisms. Who makes my batatar list? The ones that I'm very cautious working with these patients. You're going to be surprised. Turmeric, boswellia, schizandra. All three have potential of increasing dopamine, and all three I have caused worsening in my PANDAS and PANS patients during a flare. Are they okay between the flare? Maybe. I don't know. I don't think we know enough, but I just think it's really important that you stop and realize that, oh, this is good for the brain. When you're dealing with an autoimmune disease, it may not be a beneficial plant.